This conference will now be recorded.
Is the screen visible? Okay. So we move on to the male sex hormones, that is the androgens. These androgens are present as in two forms, that is androsterone and testosterone. Both the structures are present on your screen, the structure of androsterone as well as testosterone. Now, this testosterone mainly in the found mainly in the males and to some extent in the females also. This is a steroidal sex hormone, and in males it is produced mainly in the interstitial cells, or what are called as Leydig cells in the testes, when the cells are stimulated by the luteinizing hormone. And in women, the testosterone production happens from androstenedione, and in this androstenedione, part of it gets converted to testosterone, and the other part of it gets converted to estrogen, and this secretion mainly happens in the ovaries. Now, this endogenous sex hormone in males, it is mainly involved in muscle building as well as in building the secondary sexual characters in the male. So, deepening of voice or the bodybuilding that happens in men or boys after after they have reached the puberty age, development of facial hair, deep body hair, again deepening of voice, anabolic activity increases, and there is rapid growth of bones. That's why you will see boys suddenly the height increases in them. All of this is happening because of the activated or increased levels of testosterone in the male body. In the females, this testosterone plays an important role in libido, that is in having or developing sexual desire, in mood, and in general well-being and bone density of the women. So these are the two different roles that the same hormone testosterone is playing in both male as well as female. So like we have estrogenic receptors to which estrogen binds, we have androgen receptors, and this testosterone which is produced moves into the cytoplasm, and then it binds with the androgenic receptor which are present on the tissue. And after this binding happens, all the development of the secondary sexual characters, everything will begin in the male as well as in the female. Whatever is required, all the biological activities will be carried out after the binding of the androgens to its receptors. Now, in some cases, the concentration of the androgens produced is not sufficient, and because of this, there could be different issues like the spermatogenesis process will be slowed down, the sperm formation process will be slowed down, or the maturation of the spermatozoa, it will be slowed. The development of secondary sexual characters could be hampered because of all this. So in this case, you need to give the patient artificially a drug which gives a testosterone like effect. So a drug which would give a testosterone like effect, the example of this drug is nandrolone. You can see the structure on your screens. This nandrolone is an organic compound. It is a 19-nor androsterone, or it is a 19-nor testosterone, and it is an anabolic androgenic steroid. So this nandrolone, which is a anabolic androgenic steroid will bind to the androgenic receptor to give agonistic action. And when it binds to the receptor to give a agonistic action, all the hormone response which is required after testosterone binds to its receptor, all of them will be stimulated. The production of testosterone will be stimulated, and because of this, all the issues that an individual may be facing because of lack of testosterone, that is low spermatogenesis or low sperm count or late maturation of sperms or no sexual drive or the body building is not happening properly, the anabolism of the body is less, especially the protein anabolism of the body is less, and the secondary sexual characters have not developed. All these things will start happening once this nandrolone binds to the androgenic receptors, because it will stimulate the hormone response in the body. It will help in the production of testosterone. It will elevate the levels of testosterone in the body, and thereby you can get the required action. Now this is one example, and that is nandrolone. Other than nandrolone, this is the only example that is there in your syllabus. But other than this also there are drugs like danazole, or there is a drug like stanozolol. Both of them also have a similar type of action. They also have an action which is similar to nandrolone, which means they have a androgenic agonistic action after they bind. So they also will increase the production of testosterone. They will increase the level of testosterone in the body, and thereby it will help in different types of activities in which testosterone is actively involved. Okay, so this is about the drugs which are acting or which are having androgenic action or androgen like action. We next, when what we move on now is next to the anti-androgens. So what is seen is when androgen is present in a in a very large amount, there are a lot of disadvantages also which are seen. Like for example, the person will suffer from baldness. That means he or she will become bald, will lose hair excessively, or there is hirsutism. That is, especially in the case of women, it is not desirable to have facial hair, but they will have facial hair in the case of women, or in general, body hair is a very unpleasant or undesirable characteristic in women. But a lot of hair and thick hair, for that matter, will be seen, and this is usually called as hirsutism on the face, on the abdominal area. So, especially if the lady or the girl is suffering from polycystic ovarian syndrome or polycystic ovarian disease. So, baldness, hirsutism, acute acne, these are some of the disadvantages um, of having excessive amount of androgens or excessive amount of testosterone in the body. So this you can deal by using anti-androgenic agents, which means instead of the excessive testosterone that is present in the body to bind with the androgenic receptors, you will have these anti-androgenic agents which will bind to the androgenic receptors. And the examples of these anti-androgens are flutamide, bicalutamide, and nilutamide. These are some of the examples which act as anti-androgenic agents. And like I told you, they are mainly used in the treatment of baldness, hirsutism, and acne. So flutamide, you can see the structure on your screen. This flutamide is a metabolite of hydroxyflutamide, and it is the most potent anti-androgenic agent or androgenic receptor antagonist, flutamide. And bicalutamide is also anti-androgenic agent. It is in fact more potent than flutamide. The half-life of bicalutamide is more than the half-life of flutamide. Now this bicalutamide is available as a racemic mixture. Okay, there are two enantiomers of bicalutamide, R enantiomer and S enantiomer, and amongst these, the R enantiomer of bicalutamide is more or is having more affinity or higher affinity to androgenic receptors compared to the S enantiomer. I hope you all are noting down these things. Okay, so these flutamide, bicalutamide, nilutamide, they are all you can say they are anti-androgenic agents because they bind to the receptor, androgenic receptor. They don't allow the testosterone to bind with it, thereby giving anti-androgenic action. Okay, so this is one way in which you can have anti-androgenic action, which means the testosterone is present in the body, but the receptor to which the testosterone is supposed to bind or to which the androgens are supposed to bind, the receptors are not free because they are occupied by these anti-androgenic agents, flutamide, bicalutamide and nilutamide. Now, other than this action of only blocking the receptors, you could also have drugs which could prevent or decrease the production of androgen. Okay, now if you go back to the flow chart that we studied in the starting of this chapter, where you have the process in which the production of testosterone is happening from pregnenolone. Pregnenolone is converted to DHEA and DHEA is converted to testosterone and estrogen also. So this production of testosterone from pregnenolone to DHEA and then to testosterone, this is mediated by an enzyme, and the name of this enzyme is 5-alpha reductase. Okay, and this enzyme is of two types, type 1 and type 2. Okay, the 5-alpha reductase enzyme is present as type 1 and type 2. So we'll go back to that chart or flow chart which we saw, where we see that we have pregnenolone which is getting converted to dehydroepiandrosterone, androstenedione, which is forming testosterone as well as estrogen. Now this formation of androstenedione to testosterone, this requires the enzyme DHT, or in you can call it in short as 5-alpha reductase enzyme or 5-alpha DHT enzyme. Okay, there are two names. Same enzyme has two names. Either it is 5-alpha reductase enzyme or 5-alpha DHT enzyme. Now this 5-alpha reductase enzyme is of two types, type 1 and type 2. Okay, so this enzyme, the 5-alpha reductase enzyme, is responsible for formation of testosterone. Now, if you block this enzyme from action, then the concentration of testosterone or the amount of testosterone that is being produced will automatically come down. And if the testosterone production itself is happening in a lesser amount, then obviously binding of this testosterone to the androgenic receptor will also decrease automatically. Okay, so like I said, this 5-alpha reductase enzyme is of two types, that is type 1 and type 2, and the drugs that we have for the treatment using this pathway, these are the two drugs, finasteride and duosteride. I hope you can see them on the screen. Finasteride and duosteride. These drugs, finasteride and duosteride, are 5-alpha reductase enzyme inhibitors, which means they will not allow the androstenedione to form testosterone by binding with the type 2 of the 5-alpha reductase enzyme. Okay, they are specifically binding only to type 2 of the 5-alpha reductase enzyme. So these drugs, finasteride and duosteride, are 5-alpha reductase enzyme inhibitors, which will decrease the production of testosterone directly. Other than this, you have another example which we saw initially, and that example is of that example is of flutamide, bicalutamide, and nilutamide, which bind directly to the androgenic receptors. They are androgenic receptor blockers, and they have the same type of action. They will not allow, in fact, the testosterone, the already produced testosterone, to bind with its receptor, thereby giving anti-androgenic action. And mainly these two classes, that is anti-androgenic agents and 5-alpha reductase enzyme inhibitors, both these classes come under anti-androgenic agents, and they are used in the treatment of baldness, acute acne, and in the treatment of hirsutism. Okay, so this is about anti-androgens. So until now, what we have covered are mainly sex hormones, the two female sex hormones and the one male sex hormone. We have seen the production, the pathway, the biological pathway or the biochemical pathway through which cholesterol is converted to pregnenolone, and this pregnenolone is further converted to the three sex hormones, estrogen, progesterone, as well as androgens. Now, other than these three, what else is produced from cholesterol are the adrenocorticoids and the glucocorticoids. Okay, so after these sex hormones, the next important steroids that are produced by or produced from cholesterol are the adrenocorticoids and the glucocorticoids, that is glucocorticoids and the mineralocorticoids. Example is usually aldosterone and the mineral and the which is a mineralocorticoid. The aldosterone is a mineralocorticoid, and then there are different glucocorticoids also which are present. Both of them in combination are called as adrenocorticoid agents. Okay, so from here we will be moving on to see the action of these adrenocorticoids. Now these adrenocorticoids mainly are involved in the metabolism or the catabolism and anabolism of food in our body. So they are produced by the adrenal glands, which are situated above the kidneys, and they secrete both glucocorticoids as well as mineralocorticoid. The example for glucocorticoid, you can take it down as hydrocortisone, and they are mainly known for their anti-inflammatory action. Whereas aldosterone, which whose name you can see on the screen, the function of aldosterone is to maintain the electrolyte balance and blood volume. Okay, so these adrenocortical hormones help the body to adjust to different type of changes that could happen in the environment, or the different type of changes that happen in a person's diet, or they help in the stress management. Okay, like I said, they are a fight and flight situation. They will be secreted when there is a fight and flight situation, and when secreted in the fight and flight situation, they give additional energy. The catabolism rate increases in such cases, they give additional energy, and this additional energy is mainly to deal with the stressful condition that the individual is facing. Okay, so we will first see the aldosterone. This aldosterone is mainly involved in maintaining the electrolyte balance and the blood volume. Okay, you are aware that in the cell we have different types of ions: sodium, potassium, calcium, magnesium. You have chloride ions, then you have water. And when we saw the diuretics, we saw that whenever sodium moves, it will move with it chloride, or with it the position of potassium also will change. Okay, so what aldosterone does specifically is it increases the sodium reabsorption from the kidneys, especially from the distal convoluted tubule. And this increased level of sodium in the plasma will increase the blood volume, and it will um, increase the excretion of potassium also. Okay, so this aldosterone is mainly involved in maintaining the electrolyte balance, which it will mainly do by increasing the concentration of plasma sodium. Okay, and when the concentration of plasma sodium increases, the blood volume will also increase automatically. The next what we have are the mineralocorticoids. These mineralocorticoids, sorry, these glucocorticoids are basically involved in what we call as the anabolism and catabolism, or the metabolism of the body. So it controls directly the carbohydrate, protein, and fat metabolism. It will also affect the cardiovascular and nervous system. The central nervous system will be affected, and it also has what we all know as the anti-inflammatory action. They will help in glycogen storage. They will also cause uh, the stimulation of transamination. Okay. Now, if you recollect the biochemistry that you studied in your first year, you can recollect that glycogen storage stimulation, or stimulation of transamination. These are all the ways in which the body is preparing itself for a fight and flight situation. Okay, and by fight and flight situation means it is now conserving all the energy that it can, because it is aware that over a period of time the body is going to face some crisis, and for this crisis the glucocorticoids are needed. Now, other than this, the glucocorticoids also have some anti-inflammatory action. When the studies were done to see what effect does glucocorticoid have on inflammation, it was seen that it um, is acting on the levels of TNF alpha. It is acting on the levels of interleukins, granulocytes, monocytes. It is acting on the levels of interferon gamma as well, and they are inhibiting the production of prostaglandins, histamine, leukotrienes, which are all involved in inflammation. Okay, so you can use glucocorticoid indirectly as an anti-inflammatory agent. Okay, what usually happens in the process of inflammation is that a large number of granulocytes, monocytes, TNF alpha substances, all of them are produced in an inflammation, and the glucocorticoids like prednisone, hydrocortisone, all of them, they have this one action of um, decreasing the levels of prostaglandin, histamine, and leukotriene, which are mainly involved in inflammation process, and thereby they are aiding, or they aid the process of healing from a particular type of inflammation. If you recollect, during when we did local anesthetic agents, I gave you an example of using local anesthetics for mouth ulcers. Okay, so you can use these glucocorticoids also. They have a moderate to low action as anti-inflammatory agent, and they also will help in decreasing the pain that is associated with those mouth ulcers when you use it in the form of hydrocortisone, prednisolone, and prednisone. Okay, so these are the mineralocorticoids and glucocorticoids. The synthetic adrenocorticoids are divided as mineralocorticoids, glucocorticoids, and salts with little or no salt retention. The examples are already quoted: fludrocortisone, hydrocortisone, prednisolone, and the last example of this class, that is the compounds which cause very little salt retention, that is beta-methazone and dexamethasone. Okay, so these adrenocorticoids, which include both mineralocorticoids as well as glucocorticoids, play a very important role in the catabolism and anabolism of the body. They play an important role in inflammatory processes in the body. They play a very important role in maintaining the blood volume of the body. So it is not just one part. Okay, by taking them, your inflammation will come down, the swelling will reduce, the immunoresponse will be suppressed. Okay, they can be used as an hormone replacement therapy. They are used as a placebo when someone is undergoing a treatment of cancer, especially when the chemotherapy is going on. There will be a lot of pain associated. So in this case, you can use the glucocorticoids to give a palliative therapy or to give a little relief from the pain that is being caused because of consumption of these um, and anti-cancer agents. Okay, and dexamethasone, betamethasone, they are very famous products. They are all available mainly as topical agents. Betamethasone and dexamethasone, they are also available as orally active agents, and they can be used in the treatment of acne. A lot of skin preparations contain betamethasone in it, and it has a very good action over treatment of acne, or in the use in the treatment of different types of skin diseases. Okay, so this is all about the adrenocorticoids. We will quickly revise the entire chapter once. You can simultaneously take down notes if you all want of anything important that you see or you must have missed. Okay, so um, the steroids or the compounds which contain steroidal-like structure is called as a cyclopentanophenanthrene ring system, and they are of two types. One is what we know as the sex hormones, and the other is what we are familiar with as adrenocorticoids. The sex hormones are of three types, among which two are female sex hormones and one is the male sex hormone. Adrenocorticoids are divided into glucocorticoids and mineralocorticoids. Then we saw about the first female sex hormones, and that is estrogens, the different types of estrogenic substances that are present in the body, and what is the function of these different types of estrogenic substances. If there is a lack or there is less amount of estrogenic substance produced, then you can use the urine source of the pregnant mare, and you can get equine sulfate like synthetic estrogen, Similarly, you can get diethylstilbestrone, which is a non-steroidal anti-estrogenic agent, and it can be used in different ways as a placebo in cancer. It can be used to treat hormone replacement therapy in postmenopausal condition in women. It is also used in the treatment of different types of cancer and also in contraception. Okay, then we saw estrogens or estrogenic substances. We also have a condition where there is excessive estrogenic substance formation, and because of which the binding with the receptor happens more than often, which could lead to cancer. And like I told you when we were doing this part of the chapter, because when the pathological study of breast cancer cells was done, it was seen that estrogen levels in the tumor is very high. So these drugs, anti-estrogenic drugs, were designed, tamoxifen and clomiphene, which will block the binding of estrogen to its receptor, and the other is the aromatase inhibitor, which will also block the binding of estrogen to its receptor. Okay, so the example for aromatase inhibitor is anastrozole and letrozole, and like I told you, this letrozole as well as clomiphene can be used in treatment of infertility in women. Then we saw in detail about gestrogens or progesterone and the drugs which are used to get progesterone-like activity. These are the different examples: hydroxyprogesterone, medroxyprogesterone, the 19 nortestosterones, that is norgestrel and norethindrone, which will have similar action as compared to progesterone. And widely progesterone is used as an oral contraceptive agent with or without estrogen. We saw the different types of chemical contraceptions, the different concentrations of estrogen and progesterone. These are some abortifacients that we saw. There are some post-coital contraception also which is available. Like I told you, the example of the Cipla product, IPIL. And here there are abortifacients present on your screen: dinoprostone and mifepristone. Now, like we have estrogen and estrogenic substances, we also have androgen and anti-androgenic substances. So the body produces androgens in two forms, that is androsterone and testosterone. And to get testosterone-like activity, similar activity, you could have the use of nandrolone put into practice if the concentration of testosterone is less. Now, if the concentration of testosterone is very high, you require anti-androgenic agents which could stop or decrease balding, or it could be used in the treatment of hirsutism or acne. Here again we have two types. One is what are called as drugs like flutamide, bicalutamide and nilutamide. These are basically just simple anti-androgenic receptor blockers. They will not allow androgen or testosterone to bind with the receptor. On the other hand, you have 5-alpha reductase inhibitors. Among these 5-alpha reductase inhibitors, um, the enzyme 5-alpha type 2 reductase is more sensitive, it is more active, and finasteride and duosteride, they are selective for this type 2 5-alpha reductase enzyme. They will inhibit the production itself of testosterone and androstenedione. Okay, then we saw glucocorticoids and mineralocorticoids. Aldosterone, which is a mineralocorticoid, and prednisolone and hydrocortisone, prednisone. These are all glucocorticoids. And then we have some neutral examples like betamethasone and dexamethasone. Glucocorticoids play a major role in decreasing inflammation when high levels of interferons, high levels of inflammatory cells are present at the site. These steroids could be used to decrease the levels of these inflammatory agents. Similarly, we have fludrocortisone, which is a mineralocorticoid and which will boost carbohydrate metabolism, protein metabolism. It will maintain the electrolyte balance, and by maintaining the electrolyte balance, the blood volume levels also will be maintained because sodium levels are increasing. And as you know, sodium will not move alone. Along with sodium, water also will move. So the blood volume level and the electrolyte level both will get maintained by using mineralocorticoids. Okay, these are some of the examples: fludrocortisone, hydrocortisone, prednisone. They are all examples of glucocorticoids which cause moderate to low salt retention. And last are the betamethasone, dexamethasone. These are very often used as topical agents, and these topical agents are mainly having anti-inflammatory type of activity. So these are the structures of betamethasone and dexamethasone. They cause very little or no salt retention at all. Okay. So with this, we almost complete the topic of steroids.